It is time for another MU Healthcare Y107 Ask the Expert podcast. And with October being Breast Cancer Awareness Month, we've got breast cancer survivor Amy Wells as our expert today to talk about the care she received and talk more about her journey at MU Healthcare's Ellis Fischel Cancer Center. Amy, how did you know that something was wrong?
Well, thanks for having me. So I had a pain in my left breast, and I thought maybe I just bumped into something. And then it started moving towards my armpit area, and I noticed that it wasn't going away. So I went and saw my primary care physician, and I told her what was going on, and she said, you need to go to Columbia immediately. So I went up there, and they kind of fast-tracked me, which made me nervous at first, but understandable because it had gone from my breast to my lymph node. So it was on the move, and then we just started treatments almost immediately.
Amy, when you found out you had cancer, how were you supported by the team at Ellis Fischel Cancer Center?
Each patient gets a nurse navigator that helps walk you through everything. All the people that work there made me feel like I was their only patient. When I have to go do the chemo and stuff, it's amazing. The nurses there are amazing. I mean, there's like heated chairs and they'll get anything that you want. They never act like they're being bothered or frustrated. They are just calm. And like I said, I feel like I'm their only patient. They really listened to what I was saying. They took their time every time I was in there. They made sure all my concerns were covered and talked about. And I felt like they really listened to me. As bad as cancer is, they do the best they can to make you more comfortable. They were more than compassionate and helpful. I recommend them highly.
What type of breast cancer did you face, and how did Ellis Fischel treat you?
I had invasive ductal carcinoma. It's started in my left breast, like I mentioned, and moved to my lymph nodes. They decided to do a double mastectomy because my grandma had cancer, so we wanted to be cautious. So we did the double mastectomy, we did chemo, we did radiation. I'm still on medication for the clinical trial, so I have infusions, 3 more infusions left for that, and then I will have medicine that I will take for the rest of my life.
What advice, Amy, do you have for women who have been putting off a mammogram?
If you don't get a mammogram, and there is something wrong, this is not the road you want to go down. So if it's something you can prevent, go ahead. Sometimes women, especially moms, we put our health second. And it's an easy procedure. I mean, you go in, they're, obviously the specialists, they know how to do that. And if that can prevent this whole scenario, then it's silly to not do it.
You can learn more right now. MU Healthcare's breast cancer services. Log on muhealth.org/breast cancer. Some people might be tempted to go to St. Louis, Kansas City for treatment. Why did you choose Ellis Fischel?
Well, I live about 30 minutes away, so the convenience was a huge factor. And after being a patient at Ellis Fischel, I would have redone everything. The nurses, the doctors, I mean, their bedside manner is something that you don't see very often. It's a team. It's a giant team that I felt so supported and cared about. I remember when I got a staph infection and I was in the hospital, one of the nurses found out about it, and one came over and brought me some gifts and wanted to check on me. She didn't have to do anything like that. She went completely out of her way. And then everybody was asking about me, and that's just what they do there.
And Amy, I've certainly heard many stories very similar to yours. An amazing place. MU Healthcare's breast cancer services. Learn more right now on this Breast Cancer Awareness Month of October. muhealth.org/breast cancer. Is there any final thoughts that you'd like to share with our audience, Amy, about breast cancer?
I would say get screened as soon as possible. There's no reason to wait because something as simple as a screening can prevent all this. It's necessary, especially since if you don't take care of yourself, you can't take care of anybody else. Right. And you can even do self-exams, so as soon as you feel something, get in there. The thing I want people to remember is do not hesitate if you feel like something is wrong or you feel a lump. Make sure that don't put it off. It's crazy to put it off and have to deal with all this.
Absolutely. Well, Amy, again, thank you so much for your time this morning. October Breast Cancer Awareness Month, and learn more about how MU Healthcare's breast cancer services can help you and maybe save your life or a loved one's life. muhealth.org/breast cancer.